We get started. You have a recording on, yes? Can you put recording?
Yeah.
Yes, okay, good. All right, so let's go a little bit over the products. There are no dramatic changes. There are a couple of new products that we have, but we're going to start at the very basics, our sunscreens. And the sunscreens are on the bottom of the list, and we have brought in the RAD Sheer Mineral Sunscreen. This is titanium dioxide and zinc oxide based. It is a sunscreen that, when we're looking at the various skin colors, will work well in people who are very darkly pigmented. So we tried the mineral sheer versus the tinted one on darkly pigmented skin, fits 5 and fits 6, and we found that the sheer one actually looks best on their skin, and the tinted doesn't really look good on their skin. And so this was also the feedback that we got from those patients on whom we tested. So both are available. The sheer and the mineral, think about the sheer and the tinted, think about the tinted one when you have fair-skinned individuals. You know that Julie likes very much the tinted sunscreen that is made by Revision. And since we're no longer carrying, I think she also said she could actually use this one here. But think about somebody fair-skinned for the tinted one. We will continue to have the spray by MD Solar Sciences and also their stick. And so these products are still available, but they're not listed at the moment because they're not privately labeled. I'm going to go now to cleansers. And we continue to have the benzoyl peroxide wash for acne treatment, the glycolics 10% facial cleanser for acne treatment for normal to oily skin, and what we rarely use in acne prone skin, but maybe in some of our patients with atopic dermatitis, is the glycolics moisturizing cleanser. What we also have brought in is a new cleanser, and you find that not under the acne category. So when you look on the left-hand side of this sheet, acne is mentioned on the left, then underneath anti-aging, then brightening, and then we're going to go to daily maintenance. And so what we brought in by popular demand was an essential cleanser. What is the RAD Essential Gentle Cleanser? Well, it's a cleanser that basically is nice. It's a little bit foaming. It hydrates. There were many patients who were asking us, if they didn't have to exfoliate their skin, what can they use just as a gentle cleanser? And they really didn't just want to use CeraVe or Cetaphil cleanser. So the RAD Essential Gentle Cleanser takes the role of a general, very, very gentle cleanser. It has some green tea inside as an antioxidant, but that is pretty much the extent of its anti-aging property.
And what's the cost of that one?
Baruch?
Yeah.
What's the cost of that one? I don't have a list that is attached here to my sheet.
If you go in the bottom left, final complete list, you see the tab?
Yeah.
Click on it. And which one are you talking about?
The gentle cleanser.
I'll go up. So you have cost and you have price, you see?
RAD Essential Cleanser is going to be sold for, not written yet. I don't know what the tax calculates to, but it's probably going to be around $30 with tax.
You're talking about the
RAD Essential Gentle Cleanser.
Yeah, two times multiplied by 2.12.
Plus 6%. Yes. Okay. So about $30. I'm going to go back to the original list. We have a number of products that we use specifically for acne treatment. And those of you who are familiar with the products, we used to use Neostrata gel in order to pre-treat, in order to better penetrate retinoid at nighttime, in order to help hydration of people with normal to oily skin, particularly our acne players. and it was replaced now by glycential silk. So glycential silk is also a gel base. It is as sparingly used as the Neostrata gel. It feels excellent on the skin. Each of you should have a sample. It's a small sample. You know, I think the supply lasts pretty long. The drop that comes out of the sample is small enough to cover the entire face. You don't need more than that. I believe that will be the same also for the actual trade size bottle, that there's just a small drop, and you can use it underneath a retinoid if you wanted to, or you can use it in the morning and follow by sunscreen. We'll go really underneath everything, super lightweight and super silky feel on the skin. I love this product. It's a great product for normal to oily skin. And then there is the RAD Body Lotion, which is also a glycolic product. It's a lightweight, very, very large bottle. In general, what we think about when we think about this glycolic body lotion is to treat keratosis pilaris, any of the rough bumps. And then there are some people who have rough bumps on their cheeks, particularly those with keratosis pilaris, not just on the arms, not just on the thighs or buttocks, but also oftentimes on the cheeks. And those with this drier skin on their face, they can also benefit from it. Now, could this body lotion technically be used for people with oily skin? I guess probably, but it's not exactly the intended population, because it's not a gel base in which it's offered. It is really a lotion base. And this lotion base is a little, although it feels not heavy at all, it's a little heavier than what somebody with oily skin would want to put on their face before they put everything else on. So if you have somebody with normal skin and acne, maybe that's a good option, but everybody with like normal to oily skin, the glycential silk is the better option.
Dr. Ringfeld, this is Linda. How would you decide in an acne patient whether to have them use the glycolic acid wash or the glycential silk? Like, what parameters would you use to decide which one to recommend?
Well, if they have kind of really clogged pores, you know, closed comedos, I think I might potentially even consider both and not just one, you know, or the glycol pads. I mean, it depends a little bit on the degree, but you know, a cleanser is different than a leave-on product. And so your leave-on product, the glycential silk, is going to be weighing more when it comes to the exfoliative powers of the medicine. But you know, if they just simply need to do a little gentle exfoliation, then the cleanser will be sufficient. Does that answer your question? I mean, like, they're not both cleansers. One of them is a cleanser, right. The other one is a leave-on product.
Yes, that helped. Thank you.
Mm-hmm. Okay. What we don't have listed currently under the acne products is the glycol pads. I think all of you are familiar, and the name gives it away. It's glycolic acid and salicylic acid. Because of the salicylic acid, it is not indicated in pregnancy, although, you know, this is widely debated, but since the oral medication is still pregnancy category D, nobody really likes to overstep their margins. And we've also heard from Young that they're consistently not only labeling their salicylic acid products, but also now their glycolic acid products as not safe in pregnancy. And we have to find a way of overcoming that, because that's currently an issue, but that we will address with our supplier. All right, going into the anti-aging category, at this point of time, we still continue to have Elastin Skin Nectar. The peptide product is there to not just provide the peptides for overnight skin repair, but also the sequence, as most of you know, is a particular sequence that allows the elimination of denatured collagen from the papillary dermis. So it has a little bit of this cleanup function in addition to overnight repair function. There might eventually be something that replaces Elastin Skin Nectar. And at this moment, however, there is not a suitable replacement. So we continue to use it for everybody pre-procedure. Usually if they're undergoing laser procedures, resurfacing procedures, we like to use it about 2 weeks before, and then we typically encourage our patients to use it for 4 weeks after. I use it also a lot for all of my patients with rosacea. There's an occasional one who might be sensitive to the product, but overall it's great nighttime skin care for anti-aging purposes in rosacea-prone skin.
Dr. Ringbaugh, would that be a good thing to pre-treat and afterwards, like even just with full face PDL for rosacea?
Yeah, many people use it for that. I think it's good to do, but I'm not sure how much faster healing there would be with the PDL treatment, for example. But if you're thinking about anything that's a somewhat opening treatment, like fractionated radiofrequency, CO2 laser treatments, I think I recommend it typically, and also the estheticians typically recommend it more frequently.
Yes, ma'am. Thank you.
Okay. So elastin skin nectar does not provide a lot of moisture. It's really kind of, it is probably, even in people with rosacea, since I have to come back to that, it's probably better in those who have in general the oilier type of rosacea or generally oilier skin. When you have really super dry skin rosacea, maybe then that's not enough and you might have to still work with something like hyaluronic acid topical in order to, or if super dry, with powerful glycolic acid in order to drive the moisture in. So next on the list here is the Perfecting Face Balm. And this is supposed to replace the Elastin regular day cream, which they used to call restorative, Elastin Skin Restorative. And this has peptides inside, it has some growth factors inside. It says here specifically retinol free. And I don't know why we chose to actually, mention this, but this is specific. This really doesn't have anything in the retinol category. So it's a great nighttime moisturizer for every type of skin type, normal and dry skin. Will it work also for oilier skin? Yes. Again, the Elastin Skin Nectar might be the better choice there. And the same type of ingredients, but in a slightly different composition to allow a little bit of tightening on the neck, is in Perfecting Neck Balm. And so again, very, very similar ingredients, but the composition is a little bit different in order to allow for the sensitive skin on the neck to be treated. And again, growth factors, and this particular growth factor that they put inside is called kinetin, and peptides are inside of that one. And there is, in the same kind of series, in order to keep the name straight, I'm going to go all the way down to where the eyes are treated. We have this Perfecting Eye Balm. Again, very similar combination. It also has antioxidants inside, and the other two Perfecting ones don't contain antioxidants, at least not in the high concentration. So the Perfecting Eye Balm has that in addition. It's vitamin C and E, and otherwise peptides and also growth factors. And this Perfecting Eye Balm will replace Neocutis Lumiere Riche, and it will also replace the Elastin cream, I think this is what they called it. And underneath you see Illuminating Eye Balm, and that is really something that's for the darker appearance of the skin. And what we're replacing is the Thiamine eye cream, which for a long time has been the #1 eye cream to visibly undo the darkening underneath the skin, underneath the eyes. Not a long-lasting type of effect, but if used in the morning, for example, if the Illuminating Eye Balm would be used in the morning, and then the Perfecting Eye Balm at night, that's a really great combination for most people who have that combination of dark circles underneath the eyes and also have a need for anti-aging. And otherwise, I think they could even be using the Illuminating Eye Balm twice daily. It's just not absolutely necessary. I think I would prefer a peptide inside when you already do twice daily treatment of the eyes. All right, I'm gonna go back up to brightening now. Any questions so far? No. So everybody knows Melanage Advanced Skin Brightening. And I think at some point of time, we have actually taken out the word Melanage, and it's really called Advanced Skin Brightening Cream. You notice that the price has gone up to $140, and that is because we have changed the format. It is now in a pump bottle. It does also contain about 18% more volume. So the price increase is not for the pump, but for the volume. And so people, the patients will now receive 35 gram and not just 30 gram. And so when mixing, we have a new protocol in place so that the substances are adjusted to the cream. For those of you who might not know, Melanage cream contains arbutin. Arbutin is a precursor of hydroquinone. So it's not like you apply hydroquinone and it bleaches the cream on contact by inhibiting the tyrosinase, but it actually penetrates the skin. And once penetrated, it will convert to hydroquinone. So I think it is still relevant for those who have a hydroquinone allergy not to prescribe arbutin, but it doesn't cause the patchy whitening effect that hydroquinone has when applied directly with skin. So that's a great advantage of this particular cream, and that's why we love it in general. So we can apply it kind of more broadly in people with melasma. We can apply it to the cheeks and to the entire face, and it doesn't mean that they're uniformly getting lighter. In fact, the arbutase turns off the tyrosinase in areas with greater activity even more efficiently, and that's why it reduces the melasma by treating, even though you're treating the entire face and not just the melasma-prone skin. So a very strong difference to hydroquinone. And I don't know, Claire, how familiar you're with it. I think quite a bit, and I'm not sure if Marissa has now joined us, but we can compound this in various strengths of arbutin as low as 2% or even 1% if we wanted to. I'm not sure that 1% will do anything, but 2% is sometimes enough for some people. We can go all the way to 8%. It's going to be rather difficult to put 10% in because of the amount of liquid that is needed to mix in, and that makes it very soggy, but 8% is still quite a nice cream formulation. And we also do mix tretinoin into this one, and those people who would benefit from this combination with tretinoin. And it does, we can go as high as 0.1% if we wanted to. We can adjust it, we can leave it out. It's all a matter of, you know, how you guys would like to, how you would like to have it for your patients. And it does have a little bit of glycolic acid inside for enhanced penetration. Vitamin C and E are also inside. So that's important to know. If you have somebody who is otherwise sensitive to these substances, that might not be their preferred cream to use. And with the pump lid, it is now no longer necessary to tell your patients, you know, keep it refrigerated after opening to get a longer last out of it. It will turn less brown because there's very, very little oxidation going on. Once the cream sits in the pump itself, it prevents that any air influxes into the area. So the only time we're really opening it is at the time of mixing, and at that moment, there can be a hint of oxidation going on, but really not very much. The next in the list of the brightening products is the Brilliance in a Pad. It is a product that has a little bit of TCA, some antioxidants, and is great for once or twice weekly use. The product itself says to remove it after 10 minutes. Most of our patients will not remove it after 10 minutes, but leave it on. It has a bit of a smell when you first open it. It's like that TCA, not so pleasant smell, but you know, it goes away relatively fast. It is relevant, obviously, if you leave it on rather than wash it off after 10 minutes. But again, you can encourage your patient to do either, or. It's a great exfoliating product. It makes the skin feel so nice and smooth. And you know, if you want kind of pick me up for an event, this is a perfect product to use for that. Brilliance in a Bottle is a little bit different. Also contains a hint of TCA, and does contain actually retinol inside. Does contain some antioxidants, and it is great to turn over skin. You know, if you've darkened up your freckles during the summer months, this can kind of tone this down again. And for those people who want like everything in once and I don't want to bother with, you know, a retinoid separate from anything anti-aging, I think this is a great product to use and to have it as your nighttime moisturizer. It gives quite a bit of moisture as well. Is it great for the person with the driest of all skins? Probably not really super hydrating for them, but there is moisturizer inside. Again, it's this very nice smooth finish, and it tones down some of this extra pigmentation, kind of the background noise. For a morning product that is brightening, we have a combination of vitamin C, E, and folic acid. So Radiance in a bottle is our topical vitamin C product. It has the same 30% as the Revision vitamin C. It does not feel stingy on the skin because of how this is packaged in this kind of tetra form of the vitamin C, and it you know, feels good when you put it on the skin. I don't know if, I think a number of you have already started using it. It's really a nice product. The serum base is, you know, what it is. It's not, I think it's still the easiest to use, the lightest way to use. There's some other formulations available that we eventually did not choose because they felt heavier, and we really wanted something where you can really put a sunscreen on top and not feel that you're totally overloaded. Any questions so far?
Yeah, this is Linda. So in the material from the manufacturer, they did say use the Radiance at night, but we were always taught that vitamin C should be used in the morning. Isn't that correct?
Yeah, that's in general what most people feel should be done. Yes. I think, you know, I mean, the manufacturer can say anything, but is it written on the bottle that you're supposed to use that at night? Did we?
No, I don't know. It was in the product material that we initially got, that first sheet.
Yeah, I mean, I'm a huge fan of using antioxidants in the morning. I'm not alone with this particular type of view. I think, like, in general, what you tend to see from those who, you know, intelligibly talk about skincare, you know, at our various meetings, they typically will all say use antioxidants in the morning and use repair substances such as peptides, growth factors, any of those recovery complexes at nighttime. That's kind of the general dogma. But, you know, I think, you know, I think it's not problematic to use it at nighttime. It's just that if you have to, you sometimes also have to break it up. If we're using so many things, then we don't want to put everything at once. However, you know, the brilliance in a pad that actually has some of those antioxidants and has TCA is used exclusively at night just because of the retinol inside also.
Okay, thank you.
Okay. I think it's a good point. I don't know how to resolve that, but, you know, I think I feel strongly to continue to recommend antioxidants in the morning. Okay, now, next is daily maintenance. We already spoke about the Glycolics Moisturizing Cleanser. It's a great cleanser, again, for acne on dry skin, on atopic skin. It's also a perfect daily cleanser for those who really want to exfoliate their skin while cleansing. It feels good on the skin, feels really, really nice on the skin. It's great for everybody who uses a prescription regimen where the skin shouldn't get dry in addition. So anybody with rosacea, those with aggressive acne treatment and prescription regimens, they will also benefit from that. It will just really allows a nice cleansing without being harsh on the skin. We talked about the RAD Essential Gentle Cleanser as a product for those who really just want to cleanse their skin without any extras other than the antioxidants. I don't know how antioxidants really wash on. So I'm not really so sure of the actual benefit of the green tea in it. You know, I think it sounds maybe more catchy than it is. It's not like a glycolic acid that can bind and then exfoliate during the cleansing process, but you know, maybe there is a little bit of uptake of antioxidants, or maybe there's just some antioxidants left on the skin that help with that. The glycol pads go here under daily maintenance. I would like to see them move to acne. I think that's their most appropriate place. The next one would be the Hyla Essential. So this is a product that we're really not, where we haven't really replaced anything. We brought that in into the office in about May, because many of our patients felt that they really just wanted a good moisturizer, something that really moisturized their skin. So you see there are ceramides inside, there's hyaluronic acid, and it works to properly treat normal to dry skin. If you have somebody who really has super dry skin, it would be better to add glycolic acid to that. And for that, if you can go 2 down, you see Glycential Cream would be a product that has glycolic acid. It's the replacement for our Neostrata cream, which was the Neostrata cream that had 15% glycolic acid inside. And this one, this Glycential Cream, I think it feels really, really nice on the skin, and it will provide extra hydration. It doesn't have hyaluronic acid inside, and it doesn't have ceramides inside. So there could still be a person with super dry skin who may say the Hyla Essential might work better for them because the ceramides help a little bit more with this very dry feeling of the skin. But you know, ultimately it's sort of like between the two and between a patient preference and what works for them, there could be a good scenario. So it's mostly our older women who have this issue with the very, very dry skin. They will oftentimes say it occurred after menopause, and they never find anything that super hydrates their skin. So it's between the two of them, between Glycential Cream and Hyla Essential, that you might have to play around and see what works best for them. We do have the Glycential Cream as a boosted version. You see that just below the Glycential Cream. So this is the replacement for the Neostrata High Potency. So our patients that have been on glycolic acid products and love that feel, that baby smooth skin, and they want to just kind of take that extra step, they will get that particular sensation with the, or that benefit through the boosted Glycential Cream. And it's really just a step up in terms of the percentage of glycolic acid inside. So you remember Neostrata had 15% and the High Potency had 20%. So as a leave-on product, not just as a peel, of an unbuffered solution, that really made a difference in how the skin felt even smoother after that. And ultimately, all glycolic acid products are, you know, there to help polish the skin, to finish off our anti-aging pyramid, but they're really great products also to help other products penetrate.
If we had a pregnancy patient, if we had a pregnancy patient, you know, they can be on a retinoid, so we want to put them on, you know, a high potency glycolic acid for acne. Would you use the Glycential Silk or the boosted Glycential?
Yeah, so that depends on their skin type. If they have oilier skin, I would absolutely use the Glycential Silk. And if they had dry skin, then I would use the Glycential Cream. Okay. I would possibly not use, they don't oftentimes need to use the boosted Glycential. So, and I have also a hard time ever starting somebody on really high potency glycolic acid. So if they've used glycolic acid forever and they said, you know, I need something a little bit more and you need to step it up, then maybe boosted Glycential Cream might be a good option. But if they are just starting, they became pregnant and you're putting them on a new regimen, I would probably not use that as my first choice.
Yes, ma'am.
Right? I would go with the regular Glycential. Okay. Then we have, for people with oily skin, we're going to go 2 steps up to Peptide Bliss. There's a spelling mistake. It's supposed to be not Peptide Bliss, but Peptide Bliss. And this particular product replaces Neocutis Biogel. So these are people who have oily skin, who have a need to apply peptides on their skin. And you see, it's a relatively inexpensive product. It does contain hyaluronic acid for that extra hydration. Feels super light, and it does have peptides that you can use as your nighttime peptide product in the person who has that oilier skin. Can you use it on everybody's skin? Absolutely. It does not afford much moisture compared to the Hyla Essential, but again, it does have some hyaluronic acid, so it's not like entirely moisture free, despite the fact that it is in a slightly lighter kind of very, very, you know, lightweight base. Okay. And going down on the list, for the eyes, what I skipped beforehand was the Latisse, which we continue to sell. It's a great product. There are some reports with Latisse that that there's supposedly some lipoatrophy around the eye area in some patients. There have been kind of some case studies. I am not sure that full or very high-powered studies have come out with that, but some people have cautioned about that. Whether or not that affects the other eyelash stimulating substances, that has not really been studied at this point of time. But that's something to keep in mind. If you feel somebody says, I feel my eyes look really very different after I've used the teeth for a long period of time, maybe that's the time to no longer consider it. But otherwise, it's a great product to stimulate eyelash growth. I don't know if somebody else would like to give their input into that and if they have heard about it. But, in general, it's a very well-liked substance. And in general, it's not pregnancy safe. So we do ask the pregnancy question before we hand it out to patients. Anyone?
I have a question, sorry, because I just actually prescribed the Melanage to a patient today. And so she's complaining about the price, of course, because I didn't realize until just now. But we're telling her that it's an increased quantity. What did you say the new quantity is? It's
35 grams. It used to be 30 grams.
So an additional 5 grams. And in a pump bottle, so it will stay better longer.
That's correct.
Okay, great. Thank you.
Hi, it's Marissa. Sorry I was late, and sorry it says that I'm Davida. I'm not sure how to log her out. The difference between the two eye creams, can we touch on that?
Yeah. So one is strictly anti-aging. That is the Perfecting Eye Balm, and it has peptides and growth factors inside. And so, oftentimes when you get older, you have this crinkly skin around the eyes. It's kind of a great product for that. If people have dark circles, that can happen at any age. That's not a matter of old, young, or what have you. Then, and many times it's because of genetics or vascular show. The illuminating eye cream would be the better choice. It, these creams, they have these kind of almost reflective particles inside. You don't see them as particles, but they deflect the light. And this deflecting of the light creates a more pleasing look, a brighter look around the eye area. And that is why these products are then used mostly during the day. Like if you apply in the morning, that effect certainly lasts for quite some time. It's just not a repair effect. It's not ever anything where permanently you have now undone the dark circles underneath your eyes.
Okay, thank you.
Any other questions? Anybody? No? Any input? Any concerns, hesitations?
I have no concern, but I love Latisse, and you can market it for eyebrows too. It works for us.
That's right, and we do that. And so in our patients with, alopecia areata who have loss, we oftentimes use that. We do use it in people who have lost eyebrows and eyelashes after chemotherapy, and in those who just simply want slightly bushier eyebrows.
Dr. Engfeld, could you just one more time go down the list of those products that are safe during pregnancy?
All right, so as far as we know, again, there's this issue with the labeling that we have to resolve at this point of time, but as far as we know, all alpha hydroxy acids are safe during pregnancy, and that would be glycolic acid and lactic acid and mandelic acid. And azelaic acid does not belong to the hydroxy acids, but it's also an acid that is safe during pregnancy. Kojic acid is also safe during pregnancy. All retinoids are not safe during pregnancy. And and amongst all of these others, or salicylic acid is not considered. I mean, yes, in general, we know it's technically safe during pregnancy, but we should never promote it just because it has an oral counterpart, which is not. And amongst other products that we use on the skin, obviously a retinol falls in the pregnancy category C, is probably safe, but since it really hasn't been tested, we should never prescribe it. At least the studies have not been released. Retinoids are not safe during pregnancy. And other than if they absolutely need to be used, because after all, most retinoids are pregnancy category C with the exception of tazarotene. And in general, you know, if you use arbutin, that is not considered safe during pregnancy. That is a pregnancy category C. So again, has not been tested. High dose vitamin C is not safe in pregnancy, but skincare products don't contain the amount of vitamin C that would harm a pregnancy. So in general, all vitamin C products labeled for skin use are considered safe, and there's no contraindication.
So the Hyla Essential is safe, and so is the Radiance.
Yes, that's correct.
Okay, thank you.
Mm-hmm. Any other concerns, issues? Anybody who has any objection to any of the products? No? Nobody? Okay. All right. Front desk, Brittany, Stephanie, any questions about any of the products?
So I just walked back in. So you said that the Radiance, the vitamin C product, is pregnancy safe?
Yes, it
Okay.
is.
The packaging I know contradicts that. So I just wanted
Right,
to,
and again,
yeah.
and I think you have not been there where I said we have to resolve the packaging
Yeah.
issue. There's something that they're putting on these bottles that make it look and sound as if it's not really pregnancy. And you know, we have to resolve it with the manufacturer because there's no particular reason for that labeling to be on this particular product. Vitamin C has to be consumed in excess of 10,000 units, international units daily for it to, 10,000 gram daily in order to be unsafe for pregnancy. And in a topical product, you don't have that. Even your normal supplement has only 500. And so, you know, we're very, very far away from unsafe use of vitamin C.
well, I will return to using it then.
Yes.
Thanks.
Okay. All right.